Hi, my name is Lee Sorensen. I'm a certified tumor registrar at CVPH in Plattsburgh, New York. I came to CVPH in 2015, just after I completed my cancer treatment at CVPH. We also run a multidisciplinary team meeting, which we call Tumor Board, where all the doctors have a chance to bring up cases of cancer and discuss treatment options and also introduce patients for transfer of care. It was at one of these meetings that Dr. Acosta-Medieto mentioned the Perthera test. And it was during that meeting that all our ears perked up when we heard him say that. None of us knew what he was talking about. So after the meeting, we all Googled, what is this? What is he talking about? And that's when we saw the opportunity we had to help our patients here. And it was just so interesting. And that we were like, we have to tell everyone about this. Not just Dr. Acosta-Medieto. We need to let everyone know this is an opportunity out there that they need to grab and let our patients know this is available to them. So we asked the Perthera team to come virtually to one of our tumor board meetings and educate our staff. This was one of the highest attendance rates we ever had. So now I see that our physicians in the medical oncology group ask for this test right off the bat. Even if you're just walking in with a fresh diagnosis of cancer, they get this so that this test is there. So the patient knows that there are options so that if something should arise down the road where they have to switch treatment options up, this test is for them. It's individualized for them. It's looking at them as a person. And that's the best thing. I can speak from my own personal history. Like I said in the beginning, I had breast cancer and I got treated the normal way for the NCCN guidelines. I had surgery, I had chemo, and I did not need radiation. However, as a cancer survivor, there's always that little thought in your head, even after they tell you you're cancer-free, that you're going, is it going to come back? Am I going to get a different cancer? It's scary. And you have to get over that. But once I heard that this test is available and it's structured to me, I'm not that scared anymore. If it should happen again, now I know I have options. And I know those options are going to be personalized to me. And that's how it should be. The gist is, I want a personalized treatment, and not just personalized based on who I am or what I want, but I want it to go down to a chemical level, right down to my cellular level. I want that information to say, hey, we've looked at it, and we've looked at it deep. We've done a deep dive, and this is going to be the best treatment for you and the best outcome. And then as an added benefit, there's a list of clinical trials on there. So I have options. And I'll just say that when I went through the routine treatment, I didn't feel like I had options. It was just, it's okay. These are national guidelines. You'll get through it. It's textbook. It's exactly what I heard. And you're just like, okay, I'll take it. What else option do I have? But I think the Perthera test is going in the right direction. You have to look at every person individually, right down to that cellular level, and say what's going to work for them and what isn't going to work for them. Because that was one of the first things I learned coming here. I thought cancer was cancer. There's so many different variations of cancer. It's amazing. So I'm always learning. But that's the thing we have to get over, is cancer isn't cancer. I could have breast cancer and the woman next to me could have breast cancer, but we can't be treated the same because we're different. And so that's why this Perthera test and the technology, individual for me, the treatment option, that's what we have to go towards in our future treatment options versus a guideline that just kind of looks at the percentages and the best outcomes within those people treated.